Hello, and welcome to Beyond the Limb, where we explore physical therapy evidence, expertise, and innovation in limb loss and limb difference care. I'm your host, Will Riddick, a physical therapist myself, focusing on patients with limb loss and limb difference. Today, we're going to dive into how to stay current with prosthetic innovations. With the busyness of today's schedules and the fast pace of innovation and technology, it's hard for most clinicians, me included, to keep up with all the technology that might find its way into the clinic. Often it can be a challenge to find key information on prosthetic technology or where to even start. To help us out, my guest today is Cosi Belloso, a physical therapist and practice owner who specializes in working with individuals with limb loss. Cosi is the host of Cosi Talks, a weekly live stream where she connects directly with the limb loss community to discuss a wide range of topics. She's developed numerous resources for both rehabilitation professionals and people living with limb loss, and she's a frequent presenter on limb loss and prosthetic training. Notably for this discussion, she maintains a close watch on the latest prosthetic technology and its impact on physical therapy practice. Cosi, thanks for joining me today.
I appreciate being here. Thank you, Will.
Awesome. Let's go ahead and get started. Kind of give us a little bit of a background, like kind of tell us your experience in terms of what has brought you to this point, kind of in your career and what you're working on now.
So as you mentioned, I'm a physical therapist. I've been a PT now for a little over 23 years. I've worked pretty much in every setting that you find a physical therapist. So everything from level 1 trauma center ICUs, inpatient acute rehab, post-acute home health, SNF, I mentioned home health, outpatient centers. I've worked pretty much in every specialty with the exception of women's health and vestibular rehab. So I've been there, done that, got the t-shirt. I had a wonderful training early on in my career at a level 1 trauma center called Jackson Memorial Hospital in Miami, world renowned. So a lot of wonderful trauma, burn experience, spinal cord injury, traumatic brain injury. And we were rotated throughout the hospital. So every 6 months, I was basically restarting my career in a new specialty as a young therapist. And one of those rotations was the amputee rotation. And in that hospital, it was actually the least favorite rotation. So I was very nervous going in. I did not have very much education on amputee care at all. And lo and behold, my senior therapist was a man named Curtis Clark. And many people don't know his name. He's a very quiet, humble man, amazing therapist, but he was one of the ones who trained Bob Gailey once upon a time. So he was my senior physical therapist, and he basically said to me, I know you don't know anything about amputees, but I'm going to teach you everything you need to know. And he did, and the rest was history. So I had an incredible training experience with him, and that just kind of carried me through the next 20 years. And then fast forward, I'm now in Tampa and moved from Miami, moved to Tampa with my family. I went through breast cancer. I was diagnosed with breast cancer, went through all the fun surgeries and chemotherapy, and that kind of lit the fire under me to open up my own practice. And I wanted to give the amputee community the same kind of care that I received in my own cancer journey. And from that came the Cosi Talks show. So it's been a very unusual path for me these past 8 years, but it's been quite an adventure.
Yeah, absolutely. I hadn't heard about the that kind of background and that training that you had. It's
Yes.
amazing to
A
have
lot of
gone.
people are just like, yeah, yeah, because people are just like, well, where'd you get your training? Because as you know, we don't necessarily have a formalized specialty in amputee care. So,
Correct.
you got to do some name dropping there and say, well, the same guy who trained Bob Gailey, he trained me. So that gives me a little street cred there sometimes.
Yeah, but how amazing to actually have like a amputee like rotation through the hospital too.
Yes.
That's really
It was,
amazing.
and I took it for granted. I honestly thought that's how all hospitals operated. And I was with Dr. Bowker, who is one of he's, I long since retired, but his name is in many of the surgical textbooks. So I really took it for granted. And, I moved to Tampa and I was basically the lone wolf here without that support. And it was a rude awakening when I came here and realized that's really not how it works. And again, part of that motivation to, start providing that kind of a community and trying to build that community for the patients.
Yeah. Could you talk a little bit more about for listeners who might be have not seen or heard about Cosi Talks before and what you do on that platform?
Yes. So basically, I call it my accidental career. When I opened up my practice here in Tampa, I had to kind of get the word out there, like I'm open, I'm available for business. This is what I can do to help you with your mobility. So I was on Facebook answering questions in the support group, and I was very disappointed to see how little information there was out there for the general amputee community and how little resources they were receiving, especially in the field of rehabilitation. So 8 years ago, when I was typing in these questions, I accidentally hit the live button. And I see my face all of a sudden go on the screen, and I go, well, hi, I have a therapy license in Florida. Let me answer this question for you. And this was before people were really doing live shows on a regular basis. And Will, you know how great I am with technology, which I'm not. So it was a pure accident. And I just said at the end of that first show, I was like, okay, I'll be here next week if you guys have any more questions. And it just week after week turned into month after month. And I just accidentally started a talk show. And I was so fortunate that a company called College Park Industries, they are an O&P manufacturer for wonderful prosthetic feet. They were watching me, and they approached me and said that they wanted to support what I was doing. And that just opened a door to so many wonderful opportunities to work with many companies in the O&P industry. That's how you and I met, because words slowly started getting out. So I was able to start networking with other clinicians throughout the country. And it's just been a wonderful experience being able to connect with amputees that are not in my immediate geography. So now I have people, from all parts of the world that will tune in, and they'll send me questions, and I, try to help make connections for them through the process.
Yeah.
So yeah.
It's amazing how a technological glitch in a way of like getting you to live stream on Facebook has kind of led you to now be fully
It's
immersed in the technological
yes,
landscape.
yes. And Will, you've witnessed my technological idiocy at times. So that's the only way I can describe it. So again, my people like my husband and my tech team, they just kind of shake their heads and sometimes go, how in the world did you make a business out of functioning on social media and technology? But here I
And
am.
here we are talking about prosthetic
Here,
technology.
and
Diving
here we
into it
are.
more.
Yes, exactly. So, gotta
Yeah.
love the irony there.
As someone who's kind of been in this field for a good amount of time, having had a strong basis, a strong training in this, and having kind of watched technology change even over that period of time, obviously it's a lot that's changed. But from your perspective, how quickly is prosthetic technology evolving right now, even like the past couple of years?
It's incredible, and I say this all the time. So technically I started in patient care, 25 to 30 years ago. And I was training people with a satch foot and a door hinge for a knee and across the board. And I had to teach people how to, get around in their lives and in some cases even run, which the prosthetists always loved that when I would have them run on a satch foot. So it just boggles my mind that now that's something in the past. And just how quickly with the dawn of the microprocessor knee, and even just the evolution of the socket, it's kind of incredible that within quote unquote the lifespan of my career, that I've been able to witness this. And then osteointegration. I mean, that's huge. And it's changing the face of amputee care in many ways. And innovations like the targeted muscle reinnervation surgeries, as a possible solution sometimes for phantom limb pain. So, and then obviously all the prosthetic componentry that we're just constantly trying to keep up with. Back then it was, maybe 5 different feet and 3 different kind of knees, and you knew it all. And now it's like, nope, there's hundreds out there right now. And the technology is incredible. It's incredible what they're coming up with.
Yeah, absolutely. You kind of mentioned a few things, talking about like osteointegration, microprocessor knees. Are there any other kind of categories that you would put in there as like things that you've been really closely watching or things that you've seen more in practice?
Yes. So the power knee, motor actuated knees. I feel like in the courses that I teach, I have my little classification system for feet and for knees. And every time I do the course, I'm like having to update it because there's a new classification that came out. So the latest one is, the motor actuated knee. And we see that with OSER, with their power knee. We see that with a newer, smaller company called Bionic M. And I'm still, in the process of learning about these knees and who they benefit. And now we're starting to see, even microprocessor now in the hydraulic feet and ankle systems. Just even, I would say 4 years ago, you only really had like the Elan, the Blatchford Elan was the option that everybody used. And now everybody seems like they have, a microprocessor ankle and foot, and it's become very mainstream right now. And just even going back to osteointegration, it became FDA approved in the United States in 2020. And just the short 5 years since then, we are evolving very quickly with how we, the candidates that we're using in those procedures and the protocols and everything like that. So it's moving at a very fast clip.
Yeah, with this, especially going like think about osteointegration, thinking about it's only been 5 years. That's like it feels so much longer because there's been so much going on in it. Yeah,
Yes.
that's amazing.
Yes. I'd say that's the biggest one right now I've got my eye on. I'd say that and how that is evolving and impacting an amputee's choices.
Yeah. I guess my next question would be kind of related to that. How are some of these innovations like changing the way that you're approaching like gait training, educating the patient, all these kinds of things? And that's a heavy question.
Yes. No, it's a fantastic question, and it's actually something that I'm again trying to constantly keep up with it. So as you know, when they use the osseointegration, right, they have the metal implant that goes into the femur. Currently in the United States, it's only approved for above the knee amputees, and it eliminates the need for a socket. I mean, so that's huge. I mean, think about all the things that we have to go through in those first weeks to months when we're training a patient in limb volume management. Sock ply. Do we use an adjustable socket? Do we not use an adjustable socket? Oh, geez, now they've got skin breakdown because they were too aggressive in wearing the socket. Like, and then on top of that, how to stabilize a femur in a socket. So I'm sure you've heard the analogy of trying to get a popsicle stick in the middle of a cup of jello and stabilizing that popsicle stick. The challenge,
Yeah.
this is what the prosthetists tell me all the
that's a
time.
good
They're
one.
like, we're trying to stabilize a popsicle stick in a bowl full of jello, right? And with osseointegration, I mean, you are fixing the end of that femur and you are putting it in normal anatomical alignment. I mean, it's just kind of like, they regain their sense of proprioception. I mean, they're in spades. They're really getting a lot of proprioception now with all of that input going directly into that intramedullary canal. So it's incredible. In some ways, there's a lot of trade-offs. It's obviously not meant for everybody. There's a lot of trade-offs there that need to be considered, and there's many different types of osseointegration that have to be taken into consideration. But I've seen such a change in the lives of the people who are good candidates. And then when it comes to the gait training side of it, the front end, obviously you're working with some very careful weight bearing protocols. But then when you get to put them in that full length prosthesis, it's like, here we go. Like, we have that alignment, we have that proprioception. They get to utilize, the quads, the hamstrings, and the glutes the way they were meant to be done. And they have that full range of motion. So I think it's kind of cool.
Yeah.
I think it's kind of cool.
I feel like every time I get a patient, especially as we kind of make a transition from like some like lower K level componentry to higher level componentry, it's almost like a progression to not normalcy, but it's at least a kind of a stepping forward towards that more normal movement.
Absolutely. I see that a lot. Obviously, the biggest one is obviously when folks move from the K2 to the K3 knee and they get the microprocessor abilities. Although we're now starting to see some K2 knees that have some microprocessor, availability to them. That's certainly a big one that I see. And especially also, I think of the biggest one is when folks use microprocessor hydraulic ankles. Like you just see their faces light up and they go, wow, this feels like I'm finally connected to a foot and I'm connected to the ground so much better. So it's really neat to see that reaction in someone when they're trying a new piece of technology like that.
Yeah. In my own experience, I would say that especially as you're kind of coming into new technology, there's a lot of features. Like I've seen a lot more in my own clinic having a lot more microprocessor knees coming in, ones that I haven't
Mhm.
used before, and I'm having to learn kind of these things. And there's like a lot of little bits and details. I'm like, how
Yes.
do I check is this dead? Is it on?
Yeah, yeah,
Is it,
yeah.
I have to turn
It's
it upside down, or does I hold this button for 5 seconds or 10 seconds? Um,
yeah.
that said, as you're kind of unpacking and looking at these different technologies, getting some more insights about it, what are some like strategies? What are some resources that you're using to stay informed with these things?
So a lot of it is the approach on how do I look at microprocess, or how do I look at prosthetic feet, and how do I look at prosthetic knees? And that I'm not going to lie, it took me years to try to wrap my head around how do I analyze this piece of equipment that's coming to me, and how do I figure this out? Because, like I said, when I first started my career, you just had to memorize 5 different knees, and they were not complicated to memorize, right? It's impossible to do that now. You simply cannot. So I developed my little classification system for prosthetic feet. And, you've heard me say this before, starting with Sach feet, single axis, multi-axial, dynamic response, energy storing, hydraulic, hybrid feet. And then I basically, the sales reps hate it when I do this to them, but when a new foot comes to me, I tell them, which one of these does this foot fall into? Does it have multi-axial? Does it have energy response? Is it a little bit of both? And so that's kind of how I approach it. And then the same thing with the knees. Is it, how does the knee move? So is it single axis or polycentric? And then how is movement controlled in stance, and how is movement controlled in swing? And then from there, I have all the different classifications. So that's how I approach it. So for example, the other day, um, I was working with the Navi. And by the way, I'm still learning the Navi. So if I get something wrong, please excuse me, oh sir, if I got something wrong here. But I walked in the clinic and I was just like, okay, is it single or polycentric? And the process is like a single. I'm like, okay, let me start there. And then is there a hydraulic component in there? Yes. Okay. So we know that it's got the stance control through hydraulic, and the swing is also going to have hydraulic. That's what I need to get started. And then how am I looking at certain parts of the gait cycle? So for me, the most important part is when they're in terminal stance and they're bending the knee, getting ready to go to swing. Do I need to extend the leg back? Is it a toe load? How do I break the knee? And it's getting the prosthetist to speak to me in PT terms that way. How can I get this to work this way? And honestly, that's how I approach it. And as far as all the nitty gritty with the bells and the whistles and things like that, as the prosthetic training goes on and we get into the more higher level things, then I'll call upon the prosthetist to say, okay, how do we do this particular skill, whether it's doing a sharp pivot or going up and down stairs reciprocally or ramps, and learning the knee slowly that way. And then I also heavily rely upon the sales reps. And I encourage people to do this as well. They are going to be the experts on whatever product you're using, and they want for the person to really appreciate all the bells and whistles. So I rely heavily upon them as well.
Yeah, I think that's great to kind of categorize it, taking it more of a function standpoint rather than
Yes.
relying
And
on bells and whistles, as you would say.
yeah, and I joke around, like when I teach the course on this, I mean the course I teach is like 3 hours alone on prosthetic componentry and alignment. And I joke around, I was like, guys, these companies, they have all these really sexy names that they come up with for these feet, like the Maverick and the Highlander and the Odyssey and all these great
That's right.
names. And they have all these wonderful descriptions on how it'll help you leap tall buildings in a single bound on the website, but they're not telling you the function. And it's something that I really take that back to the O&P marketing companies. And I'm like, guys, this is what we need to know to make this foot work and this knee work. And this is how I explain it to my patients, because then they get it. So yeah, I gave up a long time ago trying to keep up with all the names, because it's impossible. So now I'm just like, okay, tell me what the
Yeah.
knee does, and then I'll tell you how it works and if I like it or not.
Yeah, and that makes it approachable. That's
Yeah.
excellent.
Yeah.
You mentioned kind of talking about working with the reps, for example.
Yes.
So a lot of my background, at least, I'm typically meeting up with prosthetists. I'll call my local prosthetist and say, "Hey,
Mhm.
I'm working with your patient. They've got this kind of device. Could you give me some background on that?" So that's kind of been my typical partner with that. Tell me about what
Yeah.
it's like working with the reps, or how you initiate the conversations with them, all that.
Yeah. So, and again, the way I have my practice is very out of the box. I don't work with insurance. So I'm a private boutique practice, so to speak, which it's interesting building a practice, but it also means I have a lot more freedom. So when I started my practice and the show, I started meeting some of these sales reps. And some of them would actually bring me in and they would say, "Hey, can we have you come in? We're fitting a patient for this knee and they need physical therapy. Do you mind?" I was like, "No, absolutely." And it just formed a wonderful relationship with them and then subsequently with whatever prosthetist was there as well. And I work with phenomenal prosthetists in my Tampa Bay area. But even they will say, there's hundreds of componentry out there. And the good prosthetists will say, well, we want our patients to try a lot of the things out there. And they know that through what I do with the Cosi Talks show, I get to hear about a lot of that new technology a little bit faster sometimes. So it's nice to have that reciprocal relationship between the prosthetist, myself, and the sales rep, and back and forth that way. But yes, there's so many times where I'll call the sales rep and be like, "Hey, I have no idea what's going on with this foot. What's the hype here? Why do you think this foot is so great? I want to know more about it. Who is it meant for? Or I'm hearing some trouble with this knee or foot. What can you tell me?" And just get that behind the scenes, look at it. They're incredibly knowledgeable, especially when it comes to programming these devices, which again, that's beyond my pay grade. I'll be the first to say that. So I am very happy when they were able to help out with that.
Yeah. And I think a really cool thing that you're saying there too is like you also are getting like advocating for yourself as like as a professional in this area. You're learning
Yeah.
more, you're collaborating, so you're getting what's best for the patient, as well as developing this whole relationship that helps kind of the whole community of practice, honestly.
Yeah, yeah. And I've even encouraged my viewers sometimes because, sometimes my viewers will tell me, "Well, my prosthetists say they don't know much about this foot or this knee." And I go, "Well, just politely bring it to your prosthetist and just say, 'Can we call the company and have them come in and teach us about this particular foot or knee?'" And most prosthetists, the majority of prosthetists, they want to help their patients and they're open to these things. And that to me is also a mark of a good prosthetist is when they want to bring in the new technology and the new education and hear about some of these new pieces. So yeah, it's and they're always happy to help. Like I said, the sales reps, they want their product to work, so they want to make sure that you know how it works and that it's working properly.
Yeah.
So yeah.
Are there any other like let's say online resources that you would tend to turn to?
Uh, I'm very old school. I have my library of books here that I've had, some of them since grad school, which was a very long time ago. Online, believe it or not, and I fought this for a very, very long time. Chat GPT. Chat
Really?
GPT. Yes. And it was something that you have to be very careful. I'm going to put that disclaimer out there. It has not always been correct. There are certain things that I would test Chat GPT with, and I go, "No, no, no, that's not right. No, no, no." And it corrects itself. But in terms of accessing data, it has a much broader range than I do. I don't know, like some of the databases that I don't have access to, the Chat GPT will. And it's great for quick things. Like, for example, the other day when I had to go see the patient with the Navi, and I said, "Okay, Chat GPT, what's the scoop with the Navi? Is it single? Is it poly? Is it hydraulic? Is it this or is it that?" So it actually provides a really great bank of knowledge. And then even biomechanics. I'm kind of really going down the nerd route right now with biomechanics and just really deep diving into the gait cycle and just kind of really getting in there. And it has a lot of knowledge for those biomechanics. Again, not 100% foolproof, and you do have to double check your resources and use it wisely. So, for example, if there's something that I'm not sure about, if it got it right, I'll say, "Okay, ChatGPT, give me the resource that you got this information from." And then I'll go and look up the resource. But I find that it gives me, again, I'm a lone wolf, so I don't have access to a hospital or the databases that they will have
Yeah.
access to or university. So this has been actually a very valuable tool.
I have not heard about that being used in that way.
It's fascinating, and it was I fought it for a long time because I grew up in the age of Terminator, right? So I was just like, nope, not using AI, not gonna, and I'm just old curmudgeon in that regard. But then it was just one day where I was just really struggling with something with ground reaction forces or something like that. And I'm like, I'm not understanding. I'm not. All right, Chat GPT, let's see what you got. And it explained it beautifully. And it was incredible. And it really is, you have to know how to ask the questions
Yeah.
to get it to answer. So there is a learning curve. But yeah. This is the first time I've admitted this publicly. So I don't know, we'll see. We'll see what kind of a backlash I get from this. But it's a wonderful tool if you know how to use it.
Yeah, I think in the interest of physical therapist job security, I think we could definitely argue the fact that there's definitely such a high level of like clinical evaluation and assessment with like these technologies that has to happen. Yeah. Would you say like that, like using something like Chat GPT or some kind of other large language model would be more of like for reference?
Yes. Okay. No, absolutely. It will never take, like, I'm not worried about, because I even tested it. I was like, okay, give me a physical therapy protocol for this. And it's very basic things. It's not going to be able to appreciate the nuances that an experienced clinician will have. There is no substitute for that. And I'm not worried at all about our profession. First of all, it can't show compassion. It cannot show humanity, right? And that's something that is absolutely crucial. It cannot understand the importance of patient education and how each patient has their own psychology and how to reach that patient, how they will learn better, right? You will never be able to substitute that. And that's only something you get through human interaction and experience, right? This is more of just having, I think of it more like the Star Trek computer. That to me is how I see it, where I'm just like, I need a piece of information. I need you to verify this logical piece of information. Please do so. And again, you still have to check yourself because it's not 100%. So
yeah. I'm wondering, do you ever use any resources, such as like manufacturers will often put out like instructions for use manuals? I know, like, for example, Oster and Ottobock notably have like their own academies, kind of like their online training sort of things. Have you used those, or have you found them to be useful for you?
I'll be honest. So with the companies that I've had a formal relationship with, so for example, College Park, Click Medical, I have access to their training programs. I have not looked at the Oster or Ottobock because I just haven't done their formalized academies. I will say that just on their manufacturer website, and again, this is across the board, not just Oster or Ottobock. I tease College Park about this and other folks. I go to their instruction manuals that are downloadable, the specs that are downloadable, and I have a very difficult time getting the information that I need.
It's very basic, Tinsley.
It's basic, and it's it is marketing. Part of it is also in marketing, where they'll talk about the alignment of the prosthesis and things like that, which is great. But I'm like, can you just please tell me how the stance flexion works here? Can you just please tell me like what I need to know to get this patient to go from terminal stance into swing phase? Can we just see that? Right. So that's the part that for me as a physical therapist, I wish it were just a little more straightforward.
Fair.
So yeah, but again, it just goes back to my speed dial on my OSA rep and going, hey, so how does this knee work? Tell me about it.
Yeah. Like, let's say if you were going to go to a conference and you're seeing all the latest and greatest of things that are out there. Obviously, we've kind of talked about how we can sort of categorize things to simplify our approach and how we would look at the technology. But how are some ways that you could like evaluate the technology like in that conference setting without being so sold on something?
Too sold on something? No, I will tell them, give me your patient. And I've done this. Like, I'm kind of like little infamous for this at this point, where I will just put two chairs together with their patient model, and I'll take them through my foundational gait training strategies of how I would teach a patient. And just by putting my hands on the patient and doing some of the weight shifting and some of the initial gait training strategies, that's how I know if I like the knee or not, or the foot. And just kind of troubleshooting with it, because intuitively, and I can't remember, there was a therapist who once said, we don't teach prosthetic gait, we teach human gait, right? So it doesn't matter what's sitting underneath the patient. You are going to be teaching them the same gait mechanics. And that's how I know if I really like that piece of technology that's sitting underneath them. Can I facilitate those gait patterns easily, or am I having to fight the knee? And naturally, this is provided that the socket fit is on point and we've got all of that taken care of, right? But that to me, and like I said, specifically to me, it's breaking the knee for an above the knee amputee. How did I get them to break that knee, and how easy is it for them to do that and get that knee flexion in the swing? So that's the point right there for me. Yeah.
Yeah. I think we also have the advantage of, thankfully, we're not the one that's always making the decision on the technology.
Yes. Well,
I've
I
always
mean,
thought that's such a high pressure moment for a prosthetist, saying
I'm I'm
what
kind
they're
of
going to
vocal.
select.
I'm kind of vocal about that, and I know I've ruffled some feathers in the past. I'm more vocal about the type of foot.
Mm,
And it's funny, like for me, when someone says, "What kind of a foot should I use?" I'm like, "Yes, please. Can I please be a part of that conversation?" Not that I'm, overriding the prosthetist or the patient, but I'm like, "Can I please give my input as to whether they need a more stable foot or more mobile foot?" But then once the foot is on the patient, I don't even think about the foot, right? I think
yeah.
to me, it's like the knee that I think more about.
Mhm.
And it's ironic because with the knee, I'm more about like, okay, yeah, I kind of want some input on what kind of knee we're going to be picking, but it's me more about how can we adjust the settings to make it more friendly, or how can we adjust the alignment if needed, to make it easier for the patient to use.
Yeah.
So yeah, but no, I've become a lot more vocal the older I get about saying about just putting my
Yeah.
2 cents in there. So yeah.
Um, are there any? We talked about osteointegration, how that's still coming on, and there's still development there. Are there any other technologies that have kind of been in the news, or anything that's kind of being explored out there, that you're particularly
Yes.
excited about?
Well, so the concept of myoelectrics, right? So the history behind targeted muscle reinnervation goes back 20, 30 years with Dr. Dumanian created TMR along with Dr. Kaiken,
Can you talk
and they
about
did
TMR a
it.
little bit? Kind of define it.
Yes, yes. So targeted muscle reinnervation, basically when they do an amputation strategies really haven't changed much in the past 1,000 years. Surgeon goes in, they slice through the skin, the fascia, the soft tissue, the bone. They take the nerve, they gently pull it, cut it, and then push it back into the soft tissue, right? So that nerve ending over time has scar tissue forming around it called a neuroma, right? So if it's on a motor nerve, not a big deal, right? But if it's on a sensory nerve, the patient can have some really serious fireworks, severe debilitating phantom pain, right? There's lots of amputees walking around with neuromas that don't know about it, but the ones that do know about it, it's incredibly debilitating. So again, going back 30 years, when the concept of myoelectrics devices started coming out for upper extremities, they realized a way to basically rewire the brachial plexus. So all the nerves under the arm were getting rewired using targeted muscle reinnervation, right? So they would rewire the brachial plexus into the pectoralis major muscle, and then through that connected to the prosthesis, and it became a mind control prosthesis. Well, what they noticed in the process was that, I forget the number, it was either 19 out of 20 or 26 out of 27 of their subjects, their phantom pain disappeared. And the only reason the one person still had phantom pain is because they did not address the particular nerve that was causing that phantom pain. So they realized that in taking that end of that nerve and plugging it back into the muscle at a specific motor point, they were giving that nerve something to do. They were making that nerve happy again. So I say, idle hands make devil's work. So they carried that now into the lower extremity amputee, where they said, well, if that nerve is flip flopping around in there, let's plug it back into a specific motor unit and allow it to start sprouting back into that muscle. So it's incredible how this technology originally came from trying to wire the human into the myoelectric prosthesis, and inadvertently we got a potential solution for certain phantom limb pain. So what I'm waiting for, because usually upper limb technology is more progressed, right? It progresses
Yeah.
quicker
Yeah.
because obviously the fine motor you need, right? So I'm waiting in the next few years where we are going to start to see how they integrate osteointegration and targeted muscle reinnervation into myoelectric prostheses for the feet, for the legs. So I think that's going to be the next big thing. Very Star Wars moment right there. So I'm Really look at, yeah, I know, I'm a
Hey,
sci-fi nerd,
we got
sorry.
Star Trek, we got Star
I am
Wars,
all for it. Yes. Yes.
Terminator. Yeah, we've got all
Yep.
kinds of
Yep.
things in here.
Yeah. Yeah. I'm giving away my age with all of these references at this point. But so yeah, that I think that's going to be the next big thing is seeing how it all comes together for the lower extremity amputee, osteointegration, targeted muscle reinnervation, and myoelectric.
Awesome.
So yeah.
Yeah. All right. My final question for you. Do
Uh-huh.
you have an example of like a patient that you've worked with and they've received kind of like a new to market technology, um, and just kind of like an exciting story of a patient who's kind of gone through this process of utilizing a new technology? What was that like for you and the patient?
Yes. Yeah, I'm actually thinking of one patient now that I'm actually petitioning for him to get, and hopefully that'll work out. It's a young man who has a mechanical polycentric knee, and I'm working with him right now, and I am trying to figure out how we can get him a microprocessor knee so that he can really start to rock. But I've had several cases like that, and usually it was, to me, it's always a joy when it's someone who was struggling with funding somehow, right? And again, I love mechanical knees. I love mechanical, but there definitely comes a time where the microprocessor unit can really bring about an improvement in quality of life. And I've had so many cases like that where the person was working with a mechanical component for years and years and years, and either through a donation or they got a new job where they had better insurance, something clicked where they were finally able to get like a microprocessor knee and to see their life change completely with that. um, it's very rewarding to see that because you just see, their energy becomes better. They start to feel like the leg is better connected to them. And it's beautiful to see that. Um, Honestly, the other part of it, and it's not fancy technology, teaching a patient how to run again. Uh, the running blade is a very simple, it's an elegant piece of technology, but it's very simple, right?
Yeah, fair.
And I can think of actually greatest example. I went to Guatemala 2 summers ago, 2024, summer of 2024. I took my children with me to the Range of Motion Project, and it's an amputee clinic there,
Amazing
and they
program.
bring amputees from all over Central and South America. Right, incredible program. I've already done it a couple of times, and there was a young man there, and we were at the end. We were exhausted, and they said we finally got this kid a blade, and he's an above the knee amputee. And I was like, great. And then we take him outside, and it's Guatemalan streets, right? So it's all broken stones, hills everywhere, and of course everybody has their iPhones out. And I'm like, oh sweet heavens, I've got to teach this young man for the first time how to run on an above the knee, okay, and on a rocky uphill.
Was this a fixed knee or is it, or did they,
Oh
or was it a
no,
knee joint?
oh no, 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 it was articulating. It was articulating because we didn't want to do things the easy way. No, no, we had to do it but thankfully he wasn't a very large man, and I took one of the prosthetists who was a large man, and I said to him, your job is to make sure he doesn't fall while we're doing this. And we taught him how to run, and the look on his face was just beautiful because he came from a very humble background, and the only thing that he enjoyed prior to his amputation was being able to play soccer and run. And in the Guatemalan culture, it's still a very big stigma. These disabilities, many people will never wear shorts again because they don't want anybody to see this. So for, a young man in his 20s where, all he had was the ability to play soccer, to have that taken away from him. And for him to then receive a running blade and then be taught how to use it. Um, that to me is the best way that technology can work right there. And it was a very simple blade, nothing fancy, and a very simple knee, but it gave him a piece of his life back, right there with that. So that was probably one of my favorite moments. Yeah.
That's a great way to end it out.
Yeah, that was a good one. I've had a lot of beautiful moments like that where people that, and again, it's not even so much the piece of technology, it's the fact that they got to receive a leg, and they also received the instruction to go with it.
Yeah,
So to get to play a tiny role in their story that way is pretty amazing.
that's true.
Yeah.
And I think that's one of the things that at least I've had a number of patients who've kind of confused that. It's like the technology is not the end all be all, that it is a piece of the puzzle, but you don't just throw it on and everything's magically better, but it
Right.
enables the opportunity with the right training to make it happen.
Yeah, and for them to have that understanding, to me, that's my favorite thing is when you see the light bulb go off, when you've explained something to them that perhaps they didn't understand before, or nobody took the time to explain it to them, and then they go, "I get it now." And you almost see a sense of relief for them where they're finally understanding, why their body is responding this way and how they can take control of that again, and regain that little piece of their life back with their particular mobility or skill that they do. And that's just priceless right there. That's why we do what we do, I think.
That's right. That's actually how I ended my last podcast episode.
Yeah. Yeah.
That exact quote. So,
Yeah.
all right. Well, thank you so much, Cosi. Cosi Belloso of Cosi Talks.
It's been a pleasure. Thank you.